Health Canada was an intervener against the Energy East pipeline, and they were sent to intervene by the Prime Minister's office, and we've got the exclusive documents to prove it. TransCanada's Energy East was a nearly $16 billion privately owned Canadian pipeline. It was going to bring oil from Alberta to St. John. But it died on the operating table. Justin Trudeau's Liberals added indirect greenhouse gas emissions as a consideration to the approval of the project, what the company called changed circumstances. So TransCanada pulled the plug on the pipe in 2017. Putting conditions on Energy East that the Liberals knew would result in the cancellation of the project was the original, we've got to save some seats in Quebec, undertaking by the Liberal government. And now we know the Liberals weaponized Health Canada to intervene against this nation-building pipeline. And we also know that Health Canada didn't have any good reasons to be involved, so they were left to scrambling around to invent reasons out of thin air to intervene. And the reasons they came up with were utterly stupid. Okay, let's take a look at the exclusive access to information documents we have for you today. Let's go to page 20. We see some edits to a briefing note wherein Health Canada bureaucrats initially wanted to list off various Quebec groups opposed to the Energy East pipeline to bolster Health Canada's case for meddling and being weaponized by the Prime Minister's office against Alberta interests. It reads, "We could also mention that there's a strong opposition from the general public, from many mayors of the Montreal region, where lives more than 4 million people, and from Aboriginals, First Nations of Quebec, making up 43 communities in Quebec and Labrador." Then we go forward, still on this page though. Health Canada starts inventing concerns about how the current report on Energy East does not have a human health risk assessment. It reads, "Thus far, the main concerns identified are a lack of a thorough human health risk assessment, as the report is dismissive of the likelihood of human health impacts." Yeah, no kidding. That's good. The only human health impact I can think of is an increased quality of life. It goes on. "Additionally, accidents and malfunctions and emergency response plans have not been described in any detail and thus difficult to assess potential human health risks." Now, this is the stupid excuse that I mentioned right off the top, because with 840,000 kilometers of pipelines crisscrossing this country, if pipelines were bad for us, if they'd harm our health, we'd all be dead by now. And I don't need a Health Canada study to prove that. Anyway, let's continue on to page 18. An editorial comment here makes it very clear. Health Canada had no idea about any real concerns, and instead the bureaucrats were asking if they were going to rely on Indigenous Affairs or First Nations Health to tell them what the problems were. And they also wondered if they should get training for Health Canada staff on whether or not pipelines are a health risk to begin with. It reads, "I think that this point needs to be clarified. It is not mentioned in the body of the briefing note. What does this mean for staff? Would we be relying completely on external expertise, for example, First Nations and Indigenous Health Bureau or Indigenous and Northern Affairs Canada? Will staff require extra training to be able to speak to these issues?" So much for evidence-based policy, right? Then on page 40, we get to the real conspiracy here about why Health Canada is suddenly so interested in Energy East in the first place. You can see here, we have 27 full pages of access to information redacted with the use of Section 69(1)(e) of the Information Act to exempt the information from my prying eyes. Section 69(1)(e) deals directly with the Privy Council, otherwise known as Trudeau's chief bureaucrats in his office. This act does not apply to confidence of the Queen's Privy Council for Canada, including, without restricting, the generality of the foregoing of records for the purpose of which is to brief ministers of the Crown in relation to matters that are before or proposed to be brought before Council or that are the subject of communications or discussions referred to in paragraph D. And paragraph D reads, Records used for reflecting communications or discussions between ministers of the Crown on matters relating to the making of government decisions or for the formulation of government policy. Now, that's a very long and wordy way of saying that 27 pages of this information is redacted to protect cabinet confidentiality, from which I think we can safely surmise that the Privy Council was directly involved in then directing Health Canada's involvement against Energy East. Otherwise, this information, it wouldn't have been redacted at all. I suppose Health Canada's intervention against Energy East, with bizarre, unfounded, and fear-mongering health concerns, was just the Liberals' backup plan in the off chance their insane regulations didn't scare off TransCanada to begin with. Really, Health Canada should probably stick to failing at the obesity epidemic, mishandling the opioid crisis, and overseeing an outbreak of syphilis in Alberta, because they don't seem to know what they're talking about when it comes to pipelines. For the Rebel.media, I'm Sheila Gunn Reid. What you just saw there is an example of the daily work that I do here at The Rebel. I'm an accountability journalist, and because I'm an accountability journalist, I'm being investigated by an arm of the Alberta government. I wrote a book that was critical of the former government, so now I'm being investigated by appointees of the former government because of the book I wrote. To see the full story and to help me cover the cost of my legal fight, go to savesheila.com.